Hey, thanks for joining us for a chat. I'm sitting here with Dr. Simone. We're going to be talking about preeclampsia, the risks of preeclampsia in pregnant women. What is preeclampsia?
So preeclampsia is a condition whereby a woman who is pregnant develops, I guess, a group of symptoms that, if you don't manage and treat, can have really serious complications both for mum and for bub.
Right.
Preeclampsia the main symptom that we look out for, and this is why every single time you go to a doctor's checkup during pregnancy, we always check your blood pressure.
Right.
When during preeclampsia, your blood pressure goes up.
Okay.
You can get problems in terms of blurred vision because your blood pressure goes up. You can get problems in terms of your liver not being able to cope. You can get pain in the tummy.
Is there more? Is there a type of woman that would be more susceptible to getting preeclampsia?
The more women get preeclampsia during their first pregnancies.
Okay.
Subsequent pregnancies tend to be a little bit less likely to develop preeclampsia, but if you've had preeclampsia once, then you are also a little bit more likely to develop preeclampsia.
Right.
Again, we also, if there's a history of high blood pressure in your family, then we keep a really close eye on that as well.
What are some of the signs that women should say? So we talked about high blood pressure.
High blood pressure, sometimes that can translate to things like swelling of the legs.
Yes.
So again,
that happens naturally.
Yeah, but if it happens more than you would expect it to, if you go, it hasn't been that hot, I've been keeping my feet up and my feet are swollen up like balloons, that's a reason to get things checked out. If you notice that your vision's going, if you notice that you're getting pain, especially under the right side, that can be an indicator. I guess the other things that you really want to be very, very tuned for are if there is any changes in terms of baby's movement or in terms of any bleeding or anything like that.
Right.
Now, one of the clever new developments that's happened in terms of ultrasound technology these days is that women who are having their scans at around about the 10 to 12 week mark can also have an generally routinely have an assessment made of the arteries that are going into the uterus to see whether they are susceptible to preeclampsia. And so on those ultrasound reports that we as the doctors get back, we will see whether a woman is at higher risk of developing preeclampsia or at lower risk of developing preeclampsia.
So do we need to ask the doctor for that specific test, or is it all just part of the routine test?
That's something that's part of the routine test, but if there's a history of preeclampsia in your family, or if you're particularly concerned, always make a point to ask the doctor. There are some things that can be done for women who are at higher risk. There's some great research coming out about the use of low-dose aspirin in terms of prevention of preeclampsia. And when you think about, thankfully, because we monitor things so closely, we tend to avoid most of the serious complications of preeclampsia, but mothers can go into seizures and convulsions, and it can cause the placenta to actually separate away from the uterus. So this can be a really serious condition.
Right, and I guess these are symptoms that may seem normal, but they're actually not. So do go and check with the GP or your obstetrician to make sure that everything's in check.
And get things checked regularly.
Thanks so much, Dr. Simone, for that insightful information. I think it's so important for pregnant women just to make sure they get their regular checkups and know that there is a risk of preeclampsia.